The final organ system that we're covering in systemic anatomy and physiology is the reproductive system. And for the reproductive system, I'm breaking the lectures and the labs down into male reproduction and female reproduction. But before we get started, I just wanted to show you this image. And so here we have the genderbread person. And this is an image created by Sam Killerman, who's an educator, author, and illustrator on all things gender. And why I wanted to start this series of lectures with this image is that I want to acknowledge that gender is a really broad term that can mean a lot of different things and be interpreted in many ways. For example, and I may butcher some of this terminology, and for that I apologise, but we can have gender identity. So this relates to your own personal experience and how you define your gender. We can have gender expression. This is the way in which you might choose to present your gender through your actions or your clothes. It's how you're viewed by society. We then have biological sex. So that's what we're discussing in these lectures. So the physical sexual characteristics that you're born with and that you develop, like your body shape and your genitalia. And then we have attraction. So we have both sexual attraction and romantic attraction. And we know that there are many different variations on attraction. So I guess I just wanted to point this out at the start of the lecture, that I appreciate that gender can be quite a confusing and at times even an antagonising topic. But I just wanted you to be aware of some of this complexity, I guess, both now and as you move on through your careers. So here we're talking about biological sex, but there's so much more that can actually be encapsulated by gender. So the topic of today's lecture is the anatomy of the male reproductive system, and we only have 3 learning objectives to cover, which is nice. We're going to describe the anatomy of the male reproductive system, both macroscopic and microscopic. We're going to describe the anatomy of sperm, which is the male reproductive cell. And then we're going to describe the composition of semen and where each of the secretions come from. So getting straight into it, learning objective number 1, to describe the anatomy of the male reproductive system. So the organs of the male reproductive system include the testes, a series of ducts which include the epididymis, the Ductus Deferens, ejaculatory ducts, and the urethra, accessory sex glands including the Seminal Vesicles, the prostate and Bulbourethral Glands, and then supporting structures including the scrotum and the penis. Now, all of these structures we'll obviously cover in more detail in the coming slides, but as a bit of an overview, our testes produce the sperm and hormones. The duct system that runs the entire way through that reproductive system transports, matures, and stores sperm. We have 3 accessory sex glands, which provide secretions to semen. And then we have the supporting structures, which literally support the male reproductive system, in that the scrotum supports the testes, and then the penis contains the urethra, which is how we actually deliver sperm into the female reproductive system. So starting with a closer look at the scrotum, and the scrotum is a supporting structure for the testes. It consists of a sac of loose skin, which hangs from the root or the attached portion of the penis. Externally, the scrotum looks like a single pouch of skin. However, internally, the scrotal septum, which is this part here, actually divides the scrotum into 2 distinct sacs, each containing a single testicle. Now, the location of the scrotum and the action of muscle fibres that we find within the scrotum act to regulate the temperature of the testes. And this is important because normal sperm production requires a temperature about 2 to 3 degrees cooler than our core body temperature. So down here in the scrotum is about 2 to 3 degrees cooler than up here in that pelvic cavity. Given that the testicles and the scrotum hang outside of the body then, it is more susceptible to cold weather. And so in response to cold temperatures, we have 2 muscles within the scrotum that will actually contract. We have the cremaster muscle, which is this muscle here. It's made up of a series of small bands of skeletal muscle that actually descend from our internal oblique muscles. So this goes back up into our abdominal muscles, our internal obliques. Now they come down and surround the testes, and when they contract, it will actually bring the testes up closer to the body where they can absorb more body heat. The other muscle that we have is our dartos muscle, and you can see it lying underneath the skin just here. The dartos muscle is composed of bundles of smooth muscle fibers, and the contraction causes the scrotum to become tight and wrinkled in appearance, so it wrinkles up all of this skin, which reduces heat loss. So putting all of that into words for you, and I will do this for each of the structures that we look at today. The scrotum is a loose bag of skin which sits outside the abdominal cavity. The scrotum is divided internally into two sacs, each containing one testis. The scrotum functions to support and regulate the temperature of the testes, remember, which is ideally 2 to 3 degrees cooler than your core body temperature. How it regulates your temperature of the testes is through contraction or relaxation of that cremaster muscle, which is the skeletal muscle that brings the testes closer or further away from the body. And then the dartos muscle, which wrinkles up the skin of the scrotum around the testes to reduce heat loss. Looking then at the testes, and the testes or the testicles are a paired oval gland which sits within the scrotum. Within the testes are several hundred tightly coiled tubules called seminiferous tubules. So they are these coiled ducts here, 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 here. Sperm are produced in these seminiferous tubules by a process called spermatogenesis, but we will talk more about spermatogenesis in the next lecture. Now, within those seminiferous tubules, so this is a section of the seminiferous tubules, are two types of cells. We have spermatogenic cells, so genic means to produce, and sperm, so these are our sperm producing cells. Our spermatogenic cells are all of these purple cells. We also have our sustentacular cells, which can also be called our Sertoli cells. They are these two pink cells here, and they function to support sperm production. Now, as I said, we will cover the production of sperm in much more detail in the next lecture, but very briefly we have stem cells, which arise from germ cells during the 5th week of embryonic development. So our sperm cells actually develop quite early. These will differentiate into what we call spermatogonia, and they remain in this state all throughout childhood until puberty, where they start actively beginning to develop into sperm. Now, towards the lumen, or the middle opening of those seminiferous tubules, so that's this part here, there are layers and layers of progressively more mature sperm cells. So our germ cells start up here, those sperm cells begin to develop until they become sperm right in that middle, or that lumen of the seminiferous tubule. Now, embedded amongst these sperm producing cells are our sustentacular cells. These cells nourish our sperm producing cells. They phagocytose excess cytoplasm. So you'll notice how our early sperm producing cells are quite round, where our sperm are quite sleek looking. So our sustentacular cells will actually eat away some of that excess cytoplasm. They control the movement of our sperm producing cells and also the release of sperm into the lumen of the seminiferous tubules, as well as produce a fluid so that sperm can actually be transported. Now, outside of the seminiferous tubules, in between adjacent tubules, are clusters of cells called interstitial cells. You may also see these referred to as Leydig cells. These cells secrete testosterone, which promotes the development of male sex characteristics, as well as promotes libido or sex drive. So recapping the testes, and the testes are paired oval glands that sit within the scrotum. Within the testes are several hundred coiled tubes called the seminiferous tubules, which are the site of sperm production. Within the seminiferous tubules are two types of cells. The spermatogenic cells, which develop from germ cells and move towards the lumen of the seminiferous tubules when they are mature. And then the sustentacular cells, which nourish the sperm-producing cells. They phagocytose that excess cytoplasm. They control the movement of the sperm cells into the lumen of the seminiferous tubules, as well as produce a fluid for them to swim through those tubules. Outside of the seminiferous tubules, in between adjacent tubules, are interstitial cells, and these secrete the hormone testosterone. Moving on to the ducts of the testes, and these transport, mature and store sperm cells. And as the fluid secreted by the sustentacular cells pushes sperm along the lumen of the seminiferous tubules, the sperm and the fluid moves into a series of short ducts called the straight tubules. The straight tubules lead to a network of ducts called the rete testes. And then from the rete testes, sperm move into a series of coiled efferent ducts. They then empty into a single tube called the Ductus Epididymis, or just the epididymis. So the epididymis is a comma-shaped organ, about 4 centimeters long, that lies on the posterior surface of each testis, and it's made up of mostly these tightly coiled ductus epididymis. The ductus epididymis then continues into the ductus, or the vas deferens, which we will discuss next. The epididymis is lined with pseudostratified columnar epithelium, and it's enclosed by layers of smooth muscle. The open surfaces of these columnar cells contain sterocilia, which are kind of like microvilli, and they increase the surface area for reabsorption of unused or degenerated sperm. So if the sperm aren't ejaculated, they'll be kept within the testes and the body will reabsorb them. Functionally, the epididymis is also the site of sperm maturation. So this is the process by which the sperm acquire motility, which is that ability to move, so they can therefore swim towards and fertilize an egg. And this process of maturation occurs over a period of about 14 days. The epididymis can also help propel sperm into the ductus deferens during sexual arousal, and it does this by a peristalsis of the peristaltic contractions of the smooth muscle. In addition, the epididymis can also store sperm. They can remain viable here for up to several months. As we mentioned, any stored sperm that are not ejaculated will be eventually reabsorbed. So the epididymis is a series of ducts that carry sperm and fluid from the seminiferous tubules in the testes through to the ductus deferens. It's lined by a pseudostratified columnar epithelium with sterocilia or microvilli surrounded by smooth muscle. The sterocilia increases surface area for the reabsorption of unused or degenerated sperm. The smooth muscle contracts in peristaltic waves to move the sperm into the ductus deferens during sexual arousal. The function of the epididymis is to mature the sperm so that they can move and swim towards an egg after ejaculation. But the epididymis can also store that sperm for up to several months. Continuing on from the ductus deferens, and the sperm and the fluid next move into the ductus deferens, which historically has also been called the vas deferens. I'm happy for you to use either term. This duct is about 45 centimeters long and runs from the posterior border of the epididymis through the spermatic cord and into the pelvic cavity. So you can see that here, going up, and down here. It then loops over the ureter, passes over the side and down onto the posterior surface of the urinary bladder. The lining of the ductus deferens, like the epididymis, is made up of that pseudostratified columnar epithelium, and it has 3 layers of smooth muscle. The inner and the outer layers are longitudinal, and the middle layer is circular. When sexually aroused, the smooth muscle will contract in waves of peristalsis to move the sperm from the testes up along towards the penis. Like the epididymis, the ductus deferens can also store sperm for several months, with unejaculated sperm eventually being reabsorbed. So a nice easy one to recap. The ductus deferens is a duct or a tube that transports sperm from the epididymis to the ejaculatory duct in the pelvic cavity. It's lined by a pseudostratified columnar epithelium and 3 layers of smooth muscle. The smooth muscle moves the sperm towards the urethra in the penis when sexually aroused, and the epithelium reabsorbs any unused or unejaculated sperm and can be stored here for up to several months. At the distal end of the ductus deferens are the ejaculatory ducts. Each ejaculatory duct is 2 centimeters long and is formed by the union of the duct from the seminal vesicle and the ductus deferens. So if we look at this image here, this is a seminal vesicle. This coming along here is a ductus deferens. This little portion here, where those two combine, is our ejaculatory duct. Now the short ejaculatory ducts form just superior to the base or the superior portion of the prostate, and they pass then inferiorly and anteriorly through the prostate. They terminate in the prostatic urethra, which, as the name suggests, ejects sperm and seminal vesicle secretions into the urethra. So the ejaculatory ducts are formed by the distal ends of the ductus deferens and the duct of the seminal vesicles. The short 2 centimeter duct passes through the middle of the prostate. It ejects sperm and secretions of the seminal vesicle into the urethra. So the last portion of the duct system that runs through the male reproductive system is the urethra. In males, the urethra is shared between the reproductive and the urinary systems as both a passageway for semen and for urine. The urethra is about 20 centimeters long and it passes through the prostate, through the deep muscles of the perineum and through the penis. We divide the urethra into 3 parts. We have the prostatic urethra, which is a small portion that runs through the prostate. It then continues inferiorly and passes through the deep muscles of the perineum. This section here is called the membranous urethra and is only about 1 centimeter long. Lastly, the urethra passes through the corpus spongiosum of the penis, where it is known as the spongy urethra. This portion is about 15 to 20 centimeters long and ends at the opening to the external environment, which we call the external urethral orifice. So recapping that, we've got all of this here is our urethra. The section that runs through the prostate is our prostatic urethra. The section that runs through these deep perineal muscles is the membranous urethra. The part that runs through the penis, and we'll talk about this in a second, but this tissue here is called the corpus spongiosum, is called our spongy urethra. So our urethra is that passageway for semen and urine. It's divided into those 3 parts. Our prostatic urethra, which runs through the prostate, our membranous urethra, which runs through those perineal muscles, and then the spongy urethra, which runs through the corpus spongiosum of the penis. Moving on from the urethra, and now we come to our 3 accessory sex glands, which consist of the seminal vesicles, the prostate, and the bulbourethral glands. These glands contribute to the liquid portion of semen. So starting with the seminal vesicles, and these are glands that are pouch-like structures, about 5 centimeters in length, which lie posterior to the base of the bladder and anterior to the rectum. So you can see this kind of little section here. On this angle, it's this bit here and here. These seminal vesicles secrete an alkaline viscous fluid that contains fructose, prostaglandins, and clotting proteins. So the alkaline nature of the seminal fluid helps neutralize the acidic environment of the male urethra and the female reproductive tract. If this didn't occur, that acidity would inactivate or kill the sperm. The fructose within these secretions is used to produce ATP by the sperm. The prostaglandins contribute to sperm motility, so their ability to move. It's also believed to stimulate smooth muscle contraction within the female reproductive tract to actually assist the movement of sperm towards the egg. And then the clotting proteins actually help semen coagulate or kind of clot up after ejaculation. Fluid secreted by the seminal vesicles normally makes up about 60% of the total volume of semen. So the seminal vesicles lie posterior to the bladder, anterior to the rectum. They form that ejaculatory duct with the Ductus Deferens before it turns into the urethra. They secrete an alkaline fluid that contains fructose, prostaglandins, and clotting proteins, making up about 6% of the total volume of semen. 60% of the total volume of semen. The alkalinity protects sperm by neutralizing the acidity of the male urethra and the female reproductive tract. The fructose is for ATP production by sperm. The prostaglandins help the sperm to actually move, and then also contraction of the female reproductive tract. And the clotting proteins help semen coagulate or clot after ejaculation. Next is the prostate, which is a single round-shaped gland about the size of a golf ball. It sits inferior to the bladder and it surrounds the prostatic urethra. So it's this gland here and then this round-shaped gland here. The prostate secretes a milky, slightly acidic fluid that contains several important substances. Citric acid, which is used by sperm to produce ATP. Several enzymes, which after a period of time actually break down the clotting proteins from the seminal vesicles. And then seminal plasmin, which is an antibiotic that can destroy bacteria. Secretions of the prostate enter the prostatic urethra through many prostatic ducts, and it makes up about 25% of the total volume of semen. So once again, recapping all of that information, the secretions from the prostate make up about 25% of the total volume of semen. The citric acid is used by sperm to produce ATP. Enzymes help break down the clotting proteins, which is secreted by the seminal vesicles. And seminal plasmin is an antibiotic that can destroy bacteria. The final accessory sex glands are the paired bulbourethral glands. You may also read these as the Cowper's glands. These are tiny pea-sized glands that are located inferior to the prostate on either side of the membranous urethra. So in this image, you can see that little pea-shaped gland here. On this image, you can see it on either side. During sexual arousal, the bulbourethral glands secrete an alkaline fluid into the urethra that protects the passing sperm by neutralizing acids from urine in the urethra. So if there's any urine kind of left over after a person has gone to the bathroom, it will kind of clear that out. The bulbourethral glands also secrete a mucus that lubricates both the end of the penis and the lining of the urethra. This decreases the number of sperm damaged during ejaculation. Some males will release a drop or two of this mucus upon sexual arousal and erection. And this fluid does not actually contain any sperm cells. It kind of more acts as a bit of a clean out before the rest of the semen and the sperm move through the urethra. The fluid from the bulbourethral gland contributes less than 1% of the total volume of semen. So just a small amount, typically before the rest of the semen comes through. So the bulbourethral glands, which can also be known as the Cowper's glands, sit either side of that membranous urethra at the base of the penis. Their combined secretions make up less than 1% of the total volume of semen. The alkaline solution protects sperm by neutralizing acids from urine in the urethra. The mucus lubricates the urethra and the tip of the penis. The secretions from the bulbourethral glands are sometimes known as pre-ejaculate, as it enters the urethra prior to the rest of the semen. The last organ of the male reproductive system is the penis. The penis contains the urethra and is a passageway for ejaculation of semen and the excretion of urine. It's cylindrical in shape, and it consists of a body, a glans penis, and a root. So the body of the penis is the middle section. It's composed of 3 cylindrical masses of tissue, each surrounded by fibrous tissue. The 2 dorsolateral masses are called the corpus cavernosa. So they're these 2 masses here. That would lie along the top portion of the penis here. The smaller mid-ventral, or I guess bottom, if you look at this side, mass, is called the corpus spongiosum. This actually surrounds the spongy urethra and holds it open during ejaculation. So it holds that duct open for the semen to then run through. Now, layers of skin enclose all 3 masses, which are consisted of or are made up of erectile tissue. The erectile tissue is composed of numerous blood sinuses or vascular spaces, which are lined by endothelial cells and surrounded by smooth muscle and elastic connective tissue. The slightly enlarged distal end of the penis is called the glans, so Glans. Covering the glans in an uncircumcised penis is the loosely fitting foreskin. The root of the penis is the more proximal portion, or the portion that's attached to the rest of the body. Now, upon sexual stimulation, whether that be visual, tactile, auditory, olfactory, or even imagined, parasympathetic fibers from the sacral portion of the spinal cord will initiate and maintain an erection, which is the enlargement and stiffening of the penis. These parasympathetic nerve fibers produce and release nitric oxide, which remember we talked about in the urinary system. And nitric oxide causes the smooth muscles in the walls of the arterioles to relax. It causes the vessels within this erectile tissue to dilate, which in turn causes a large amount of blood to enter that erectile tissue of the penis. Nitric oxide also causes a smooth muscle within the erectile tissue to relax, resulting in the widening of these blood sinuses. And so that combination of the increased blood flow and the widening of these blood sinuses results in the erection. Expansion of blood sinuses also compresses the veins that drain the penis, so there's more blood going in and there's less blood leaving, which helps actually maintain that stiffness. Now, the major function of the penis when reproduction is the priority is to deliver the semen into the female reproductive tract during ejaculation. Ejaculation is the powerful release of semen from the urethra to the exterior of the body, and it's a sympathetic reflex coordinated by the lumbar portion of the spinal cord. So the parasympathetic nervous system actually causes the erection, but the sympathetic nervous system causes ejaculation. As part of the reflex, a smooth muscle sphincter at the base of the urinary bladder closes so that urine isn't expelled during ejaculation and that semen can't then enter the bladder. At the moment of ejaculation, peristaltic contractions in the epididymis, the Ductus Deferens, the Seminal Vesicles, the Ejaculatory Ducts, and the prostate will propel semen and their secretions into the spongy portion of the urethra. And then muscles surrounding the urethra will contract and propel semen out of the penis. Once sexual stimulation of the penis has ended, the arterioles supplying the erectile tissue will constrict, the smooth muscle will contract, it makes these blood sinuses smaller, the pressure on those veins is released, and the blood can drain through them. Consequently, the penis will turn to its relaxed or its flaccid state. So the penis contains the urethra, which is the passageway for semen and urine. However, the primary function of the penis when we're considering reproduction is to deliver the semen into the female reproductive system. The middle or the body of the penis is made up of three masses of erectile tissue. So two, I guess, on the upper side, which are called the corpus cavernosa, and one on the underside, which is the corpus spongiosum. This one surrounds the urethra and will hold it open during ejaculation. When sexually stimulated, the parasympathetic nerve fibers release that nitric oxide, which causes vasodilation of the blood vessels in erectile tissue, allowing them to fill up with blood. During ejaculation, which is a sympathetic reflex, peristaltic contraction of all of those ducts and accessory glands will expel semen into the urethra, where muscles surrounding the spongy urethra will then expel the semen from the body. Now, moving on from the anatomy of the male reproductive system and taking a look at the anatomy of the male sex or reproductive cell. So learning objective number 2 is to describe the anatomy of sperm. So each day, about 300 million sperm are produced. A single sperm is about 60 micrometers long and contains several structures that are highly adapted for reaching and penetrating an egg from the female reproductive system. The major parts of a sperm cell are the head and the tail. The flattened head is about 2 to 5 micrometers long. It contains a nucleus with 23 highly condensed chromosomes, which, if that sperm fertilizes an egg, becomes the male's genetic contribution to that newly formed baby. Covering the anterior surface of the head is an acrosome. This is a cap-like vesicle that's filled with enzymes that help a sperm penetrate an egg to actually bring about fertilization. Now, the tail of a sperm is broken down into 4 parts. We have the neck, the middle piece, the principal piece, and then the end piece. The middle piece contains lots and lots of mitochondria. So this provides the energy for the sperm to actually swim to the site of fertilization to meet up with the egg. Once ejaculated, most sperm do not survive more than 48 hours within the female reproductive system. So a recap of our sperm in text. A sperm is made up of the head and the tail. The head contains the nucleus, which contains 23 chromosomes, so the genetic material from the dad or the male, as well as the acrosome, which contains enzymes to help penetrate the egg. The tail is broken up into 4 parts. The middle piece contains many mitochondria so that the sperm can swim towards the egg for fertilization to occur. After ejaculation, sperm do not survive for more than 48 hours within the female reproductive tract. And then the last learning objective for the anatomy of the male reproductive lecture is to describe the composition of semen. We have somewhat already talked about this. So semen is a mixture of sperm and seminal fluid. Seminal fluid is a liquid that consists of secretions of the seminiferous tubules, the seminal vesicles, the prostate, and the bulbourethral glands. The volume of semen in one typical ejaculation is between 2.5 and 5 milliliters. And within that, there's going to be between 50 and 150 million sperm per milliliter of semen. When the number of sperm falls below 20 million per milliliter, it's considered that the male is likely to be infertile. Now, such a large number of sperm are required for successful fertilization because only a tiny fraction of these sperm actually reach the egg. The seminal fluid provides sperm with a transportation medium. with nutrients and protection from the hostile acidic environment of both the male's urethra and the female's vagina. And as we've covered already, the secretions from the seminal vesicles make up about 60% of the total volume of semen. These secretions are alkaline to neutralize acidity. They contain fructose for energy, prostaglandins to help with sperm motility or sperm movement, and clotting proteins to help the semen coagulate or clot up after ejaculation. The secretions from the prostate gland make up about 25% of the total volume of semen and contain citric acid for ATP production, enzymes to break down the clotting proteins, and then seminal plasm, which is an antibiotic. The secretions of the Bulbourethral Glands make up less than 1% of the total volume of semen. The alkalinity of the fluid neutralizes the acidity of acid in the urethra, and it lubricates both the urethra and the tip of the penis. Once ejaculated, liquid semen coagulates, so clots up, within 5 minutes due to the presence of those clotting proteins. After about 10 to 20 minutes, this semen then reliquefies because of those enzymes from the prostate. Abnormal or delayed liquefaction of the clotted semen may cause partial or complete immobilization of the sperm, and then therefore inhibit the movement of those sperm through the cervix of the uterus towards the egg. And that is it for the anatomy of the male reproductive system. In the next lecture, we'll talk about the process of spermatogenesis or sperm production, as well as the hormones that regulate the male reproductive system. Thank you for listening, and see you next time.